So low-grade serous ovarian cancer, or as it's known by its acronym LGSOC, is a rare type of epithelial ovarian cancer. So serous cancers account for about 60 to 70% of all epithelial ovarian cancers, but of those 60 to 70%, 90% are high-grade serous carcinoma, which is a more aggressive type, and only 10% or less are low-grade serous carcinoma. So just highlighting the fact that it's very rare. The binary grading system for distinguishing low-grade from high-grade serous carcinoma was introduced in 2004 by the MD Anderson group, but it took another decade for it to be really embraced by the international gynecologic pathology community and to be adopted by the World Health Organization. Low-grade serous ovarian cancer affects younger women, so the average age is around 45 versus about 63 for high-grade serous carcinoma. Like high-grade serous carcinoma, most cases are diagnosed later in stage 3 when the disease has already spread into the upper abdomen. And also, like high-grade serous carcinoma, about 70% of women will relapse at some point during their lifetime. On the other hand, low-grade serous carcinoma has a much better prognosis than high-grade serous carcinoma, with an average overall survival in the 10 to 15-year range, compared to high-grade serous carcinoma, where it's 40 to 60 months. Because these women on average are younger, fertility preservation is a concern for a number of these women. I would also say that there are no drugs that are specifically FDA approved for the treatment of low-grade serous carcinoma, kind of highlighting the fact that it is a rare type, and there's less interest by pharma and there's less funding for it. But nevertheless, over the last 15 years or so, we've actually been able, despite this, to make progress in the treatment of the disease, even though it's not as sensitive to chemotherapy as high-grade serous ovarian cancer. We know that endocrine therapies, such as those used for breast cancer, and some targeted therapies, such as MEK inhibitors or BRAF inhibitors and other drugs, can be effective in the treatment of this disease. So this was an online survey sponsored by Verastem Oncology and conducted by the Harris Poll on behalf of the LGSOC Patient Advisory Committee. And that committee included representatives from STAR Ovarian Cancer Foundation, Cure Our Ovarian Cancer, and the World Ovarian Cancer Coalition. The survey was developed by experts in the field, along with patient advocates working with Verastem Oncology. And when it was developed, we knew that it would take about 15 minutes to complete the survey. In July and August of this year, 186 women completed the survey, all of them, of course, who had low-grade serous ovarian cancer. The majority of the women were from the United States, but there were also patients from the United Kingdom, Canada, Australia, and New Zealand. And so we really developed this survey to highlight some of the concerns that patients may have in an effort to better be able to serve them in the future. They did not really surprise me. I would say the top line findings that emerged out of this survey: number one, about 81% of women had symptoms, and of those women, amazingly, it took nearly 3 years for them to obtain an accurate diagnosis of low-grade serous carcinoma, because many times this is initially diagnosed as a high-grade serous ovarian cancer. 60% of the women indicated that they had had a misdiagnosis at some point in their clinical course. Nearly 66% of the women said they had symptoms that were dismissed by their healthcare provider. And 82% of women said that if they had known about this disease, they might have been diagnosed more quickly. Only about 40% felt that their healthcare provider who made the diagnosis was actually very knowledgeable about low-grade serous ovarian cancer. I think this underscores the fact that we need better education, both of women about ovarian cancer in general, and also about low-grade serous ovarian cancer. And we also need to educate OBGYNs and primary care physicians to know more about the diagnosis, again, of ovarian cancer in general, but also specifically the nuances related to low-grade serous ovarian cancer.